In the first few days, effective removal of the very small amounts of colostrum on a regular basis stimulates production. Many babies who are with their mothers need help and time before learning to breastfeed effectively. Hand expression and spoon feeding after breastfeeding can provide more stimulation to the breast and more milk for the baby than breastfeeding alone. Mothers who are separated from their babies need to begin pumping within hours of delivery. Some mothers find it difficult to remove colostrum with an electric pump. In the first 3 days, using both the pump and hand expression can increase later milk production. This mother is learning to hand express for her 1-day-old son, born at 28 weeks gestation. A 1 cc vial works well for both collection and transportation of the milk to the intensive care nursery. A new mother who can effectively express small volumes of colostrum into an appropriate sized container and watch it being given to her infant can better understand the important protective role only she can provide for her baby. Whether your baby is premature or term, here are some steps to help you get started. It is very simple to learn and teach hand expression. In the first couple of days, the average size of a good breastfeeding for a term baby is only a teaspoon. So all we expect to express each session is a few drops to a teaspoon. The more frequently milk is expressed, the sooner milk comes in and the more milk is produced. Partners can help if mothers are too sick. Mothers may find the following suggestions helpful. Have the mother sit up so that gravity is working for her, not against her. Use gentle massage over the breast with hands, a soft baby brush, or a warm towel. It'll help get the milk beginning to flow. Already we can see just with that.
Oh yeah.
That just the massaging.
That's great.
Exactly. That's really good. Place fingers an inch away from the areola, making a C. Band-Aid markers make it easy to remember finger placement. I'm not going to get my fingers down here with a C. I'll keep them here so that the nipple is in the middle of my thumb and my pointing finger. Apply steady pressure inward towards the breasts, never massaging outward towards the nipple or the spoon. So back and then very gently together, and back and very gently together. And I don't expect to see anything in the beginning. So just know that in the very beginning, even when the baby nurses, she doesn't get anything. She's just beginning to sort of stimulate the milk to let down. And then, and the reason I just go very gently is so your breasts get kind of used to it first. And rather than stay on one breast, I go back and forth. So I go from the right to the left and right to left and back and forth. When I push back, I don't tighten up the skin, the dark skin. I don't pull like this. I just go straight back and together, and straight back and together. And then we'll get the milk flowing a little bit, and then I'll show you how to do it. And then we might as well start collecting a little bit.
Yeah, sure.
So remember when you try to do this yourself, that in the beginning, the milk didn't come very easily. And now it's coming very easily. Think of press, compress, relax. Press, compress, relax. In contrast to the breastfeeding baby, who, with her tongue and jaw, massages the ducts beneath the areola, with hand expression, we apply compression further back and deeper into the breast tissue. Press, compress, relax. Press, compress, relax. You make your hands really, really relaxed, and I'll do it for you. And I'll push back, and then we'll come together. And we'll push back, and come together. And then relax totally, push down, and come together. So it's sort of press, compress, and relax.
Okay.
Press, compress, and relax. Go back and forth from right to left to right to left. By alternating sides, the bursts and pauses of milk expression simulate the normal pattern of suckling of a baby. Avoid tightening or stretching the skin over the areola. Think of almost pushing it together, then push back,
Okay.
and then come together.
Oh, yeah.
You see, if you tighten it, it doesn't, think of it the way it's inside a baby's mouth. If you make it a little bit looser like this first, and then kind of push down and come together, I think you'll find that it comes out a little bit more. If I tease back like this too much, then I suppose I'm blocking
So
the
first
ducts.
you pinch,
Yeah,
then you press,
and then come
and
together.
then-
That
okay.
works a lot better, doesn't it? Develop a rhythm like a baby nursing. That is just perfect.
Wow, that's a lot.
The more frequent hand expression is used, the easier it becomes, the earlier milk comes in, and the more milk mothers will make. The vials or syringes of milk can be collected in a cup of ice and taken to the nursery for the baby. After breastfeeding, hand express and feed this to the baby from a spoon when she is propped up. The more often you do this, the better. The more milk a mother has, the easier for the baby to breastfeed. Think of it this way. You are phoning in your order for lots of milk later on. Once your milk comes in, and when you can depend on your baby to keep your milk supply steadily increasing, you'll no longer need hand expression to help empty your breasts.